Welcome to the Explainer. Today, we're diving into the thyroid clinical exam. Now, this is a procedure that seems really simple on the surface, but it's absolutely packed with some serious detective work. We're going to explore how clinicians can use just their eyes and their hands to uncover vital clues about your health, all hidden in plain sight, right there in your neck.
Okay, so let's get right into it. What can a doctor really learn just by looking at your neck? Well, it turns out a whole lot more than you might think. A skilled examination of this one small area can be a huge window into your body's entire metabolic health. It's pretty amazing.
So, before a doctor even touches your neck, they need a mental map of the territory, right? Let's quickly go over the basic anatomy of the thyroid, because knowing what's supposed to be there, well, that's the first step to spotting when something isn't quite right. So here it is, this small butterfly-shaped gland. Think of it as the engine of your metabolism. It produces these absolutely critical hormones. And its location? That's everything for this exam. It's literally wrapped around your windpipe, or your trachea. And that's not just some random fact. It's the key to understanding why it moves the way it does. All right, the exam begins, and the very first tool is the simplest one we have, the eyes. Before any touching or prodding, a clinician just looks. This initial inspection is all about gathering those visual clues from every possible angle. Now, to make sure nothing gets missed, this visual check is broken down into a 5-step process. It's super methodical, it starts with just positioning the patient correctly, and it ends with a really close look at the skin. So let's walk through each one. So the first step is super simple. The patient just sits up and tilts their head back a little bit. Why do that? Well, this simple move stretches the skin taut across the neck, and that makes the contours of the thyroid area stand out. It's kind of like pulling a sheet tight over an object just to see its shape more clearly. Now, here's a really interesting part of this clever little technique for getting better visibility. By having the patient push their head back against their own hands, the neck muscles tense up, and that can make even a subtle swelling just pop right out. It's a fantastic trick of the trade. Okay, this is a key moment in the exam. How do you know for sure that you're looking at the thyroid and not something else? Movement. See, the thyroid is basically anchored to your voice box, so when you swallow, that whole structure moves up as one unit. If it moves when you swallow, you know you're in the right place. At this point, the clinician becomes a bit of a cartographer, literally mapping out any swelling. They're not just looking at a lump, they're documenting its size, its shape, its exact location. Is it symmetrical? Where do its borders end? Every single detail is a clue that gets added to the case file. The surface texture itself is the next big clue. Is it smooth? That might suggest a single uniform growth. Or is it kind of lumpy and irregular? That nodular surface often points towards something called a multinodular goiter, where multiple little growths have developed inside the gland. And these last few observations can point to things like inflammation, maybe past surgeries, or even increased blood flow to the gland, which can be a big sign of an overactive thyroid. And those dilated veins, sometimes they indicate that a large goiter is causing a bit of an obstruction. Okay, so now that we've gathered all the visual clues we can, it's time to add the sense of touch. This next step, palpation, is where the examiner really goes from a 2-dimensional picture to a full 3-dimensional understanding of what's happening right under the skin. So to get that complete tactile picture, clinicians use 3 main techniques. Each one has a very specific job, and they're often used together to explore the gland from every possible angle. This is really the foundational technique. By coming up from behind the patients, the clinician's fingers can rest really comfortably over the 2 lobes of the thyroid. This position gives them a great general feel for the gland's overall size, its shape, and its symmetry. Now this one is a more targeted technique. The clinician uses one hand to gently push the windpipe over to one side, which makes the thyroid lobe on the opposite side kind of pop out a little bit. This lets their other hand get a much better feel of that lobe, especially the parts that are usually tucked away and pretty hard to reach. And this is brilliant. It shows how combining movement with touch can reveal these tiny little details. As the patient swallows, the thyroid gland slides up and down right under the examiner's thumb. This allows even very small nodules to be felt as they just pass by. So clever. So what are they feeling for? Well, every one of these sensations adds another piece to the puzzle. Is the gland soft, which might suggest a benign growth, or is it rock hard, which is a much more concerning sign? And a really crucial check is feeling for that bottom edge. If you can't feel it, that's a major clue that the goiter might have started growing downwards into the chest cavity, a condition we call a retrosternal extension. And here's a classic clinical pearl for you. It's a little counterintuitive, right? You'd think a fluid-filled cyst would feel soft, but actually it can feel quite firm because the fluid is under pressure. Meanwhile, a benign solid growth, an adenoma, often feels softer. This kind of distinction is exactly what palpation helps a clinician figure out. Okay, so we've covered the basics of looking and feeling. Now let's move on to a few advanced tests. These are really specific maneuvers that are designed to hunt for certain red flags that could point to more serious conditions. First is feeling for something called a thrill. It's this fine, buzzing vibration, almost like a purring cat. This is caused by really rapid blood flow, and it's a classic sign of an overactive thyroid. Next, the clinician checks to see if the trachea has been shoved over to one side. And finally, they check for fixity by seeing if the swelling moves independently of the skin and muscles around it. If it feels stuck down, that's another important clue. Now, this is a critical safety check. A positive Kocher's test, that's where gentle pressure on the goiter causes this high-pitched breathing sound called stridor. That is a major red flag that the person's airway is already being significantly compressed. This test checks the swelling's relationship with a major blood vessel running right alongside it in the neck. So, if that carotid pulse is muffled or even gone, it raises a really serious concern that a malignancy might be invading and encasing the artery. So after all of that looking and feeling, what we have is this collection of clues. And now, for the most important part, what does it all mean? This is where all that detective work really pays off, and all the individual findings get pieced together to start forming a diagnosis. And this table just brilliantly summarizes how these specific findings point towards potential diagnoses. So that palpable thrill we talked about, it suggests an overactive gland. Can't feel the tracheal rings? You start thinking about extension into the chest. A weak pulse or a rock-hard consistency? That raises a suspicion of cancer. This is exactly how observation gets transformed into actionable clinical information. And this really brings us to the most important takeaway of all. A thyroid exam might feel like it's just about the neck, but it's not. Not at all. Because the thyroid acts as the body's thermostat, controlling our metabolism, this simple, hands-on examination is an incredibly powerful window into a person's overall health. It's a perfect example of how a focused, local exam can reveal clues about the